This is Sally. She's a 6-year-old girl. Sally has just been told she has the chicken pox. How did Sally get the chicken pox, you ask? Good question. This is Billy, a snot-nosed boy in Sally's kindergarten class. Billy, knowing that he had the chicken pox, came to school because he loves eating crayons. Poor decision on Billy's part. After chewing on the lovely Crayola crayons for a solid 15 minutes, Billy decides to stop his filthy habit and go play with some other toys. Unknowing of what Billy has just done, Sally, being a fabulous artist, grabs the crayons and has mistakenly forgot to wash her hands after coloring and has grabbed her apple for snack time. Chickenpox being an airborne virus, Sally now has the virus. Chickenpox is caused by varicella zoster virus, a member of the herpes virus family. Chickenpox is a common infectious disease with an estimated 6 million cases occurring annually worldwide. In temperate regions, the disease usually affects children under the age of 10. In tropical regions, adult cases are more common. The rate of infection is immediate of race or gender, but is much lower in countries where vaccinations against the disease is practiced. A person with chickenpox is contagious from 1 to 2 days before the outbreak of the chickenpox rash to about 6 days after the rash erupts. After being exposed, a person will normally show symptoms of chickenpox. To 21 within 10 individuals normally get chickenpox only once in their lifetime.
As we return to looking at Sally, 10 to 21 days after her run-in with snot-nosed Billy, Sally is finally showing symptoms of the chickenpox. Poor Sally, within a few hours or days, has small red spots beginning to appear on her scalp, neck, and upper half of the trunk. After a further 12 to 24 hours, the spots typically become itchy, fluid-filled bumps called vesicles, which continue to appear for the next 2 to 5 days. In any area of skin, lesions in a variety of stages can be seen. These blisters can spread to cover much of the skin and in some cases may be found inside the mouth, nose, ears, vagina, or rectum. Some people develop only a few blisters, but in most cases the number reaches 250 to 500 spots. To relieve the itching, Sally's mom is giving her oatmeal baths, covering her in calamine lotion, and giving her acetaminophen to relieve her fever. Thankfully, Sally has not spread the chickenpox virus to anyone she has come near so far. Thankfully, for those who have never had chickenpox, the U.S. had produced a vaccine in 1995, the varicella vaccine. This vaccine is a shot given subcutaneously, which means under the skin. It is recommended for all children under 13 and for everyone 13 or older who has never had chickenpox. 2 doses are always recommended. In the first case, a first dose is administered at 12 to 15 months and a second dose at age 4 to 6 years. For people older than 13, the 2 doses are administered 4 to 8 weeks apart. The possible mild side effects include redness, stiffness, and soreness at the injection site, as well as a fever. There's a short-term risk of developing herpes zosters, which is shingles, following vaccination. However, this risk is less than the risk due to a natural infection resulting in chickenpox. Most of the cases reported have been mild and have not been associated with serious complications. A few people may develop a mild rash, which usually appears around the shots area. According to the American Academy of Pediatrics, clinical trials have demonstrated that varicella vaccine is 70 to 90% effective for preventing varicella and more than 95% effective for preventing severe varicella.
Soon, Sally had thought she had recovered from her chickenpox and returned to school. Being that some groups, such as infants, are at risk for developing complications, the most common of which are bacterial infections of the blisters, pneumonia, dehydration, encephalitis, and hepatitis. These complications occur much more often among young children less than 1 year old than among older children. The threat is greatest to newborns, who are at more risk of death from chickenpox than any other age group. Under certain circumstances, children born from mothers who contract chickenpox just before delivery develop the disease and face an increased possibility of dangerous complications, including brain damage and death. If the infection occurs during the first half of the pregnancy, there is a small risk of the baby being born with congenital abnormalities. Immunocompromised children whose immune systems have been weakened by a genetic disorder, disease, or medical treatment usually experience the most severe symptoms of any group. They have the second highest rate of death from chickenpox. Adults and children aged 15 and older are among a group in which typical symptoms of chickenpox tend to be more severe, and the complications are much higher than among young children. Adults are 10 times more likely than children to require hospitalization from chickenpox. Unfortunately, Sally had returned to school early and has given the chickenpox to her BFF, Georgia. Chickenpox can be an ongoing cycle if not vaccinating. It is important to keep up vaccination and be informed about the virus, and to stay at home until you are better to prevent the spread of the virus.